Well, welcome everyone to this week's edition of It's Worth a Shot. Today is January 18th, 2023. My name is Jessie Kinsey. I'm an account manager here in Montana. And this week on our It's Worth a Shot series, we will be discussing ICARS, the ICAR program in Hawaii, as well as welcoming a special guest administrator from one of our long-term care facilities in Eastern Montana. And we'll be talking about COVID unit mitigation practices, a little bit of best practice sharing, and survey preparation. All right, next slide, please. Many thanks, of course, to our guest speakers, our partners, our attendees. It is incredibly hard to believe that today marks 1 year of hosting these presentations. So we certainly hope that these have continued to bring value, your direction, and we always invite your feedback. Next slide, please. So with that, feel free to continue to offer webinar topic ideas, clinician ideas. If there's anything that we can do for you or any hot topics that you would like to hear more about, or even if you would like to be a guest speaker, please reach out and we'll continue to meet every Wednesday. With that, we do have a couple polling questions this week. We actually have two. First polling question, does your community hospital offer COVID-19 vaccinations upon discharge? Yes or no? This seems to come up quite frequently as far as a barrier with those new admissions. Give everyone just a few moments to answer that. See if we can break 20 for participants in the polling question. We're almost there. All right. So far it looks like most folks, the hospital is not offering COVID vaccines upon discharge. I feel like this would be helpful in our mission. All right, go ahead and end that poll, Mary. Thank you guys as always for participating in those. And then we have another polling question today as we explore, let's see here, some other avenues in which we try to support our communities and our partners. This one, resident anticoagulant use may be for both necessary and lead to unintended effects. Would you be interested in an educational webinar on any of the following? And again, your participation is much appreciated. Like most folks, oh, neck and neck there. Review of regs would be helpful. Looks like there's still a few more responses coming in, so I'll let you guys answer that. All right, excellent. It looks like most folks would really like some supporting information on regulatory requirements and potential tags. All right, thanks again. All right, next slide, please. All right, per usual, we'll take a quick look at this weekly influenza snapshot. Really good news that we are seeing a decline, although the seasonal influenza activity continues. We are super fortunate to see a decline in most areas. Of note, we're continuing to see some pediatric deaths. There was 5 additional pediatric deaths reported this last week, unfortunately. The number of flu hospital admissions, though, overall did decrease as compared to the previous week. And again, the majority of the influenza viruses that are being tested are showing to be a good match to this year's vaccine. So just again, a reminder, annual flu vaccine is the best way to protect against flu, and vaccination helps prevent infection and also other potential serious outcomes. So nice to see that line dropping down. Let's keep our fingers crossed it stays there. Next slide, please. As we look at our weekly COVID-19 snapshot, again, we kind of see this irregular pattern with some of the data. They are noting some data delays that may be contributing to these irregular patterns. Notably, the increase in deaths this last reporting period. However, we fortunately did see a decrease in hospitalizations. In general, we, as of this last reporting period, about 69% of US population has completed a primary series, and we're just over 15% for those that have received a booster. So continuing to encourage folks that are eligible to consider becoming up to date. And then Holly, you have a question in there. I will drop off the link for you and answer your question. I'll put it in chat. So, all right, next slide, please. So without further delay, I'd like to introduce our first guest speaker, Kelly O'Leary. She's an infection preventionist coming to us from the Big Island in Hawaii with the Hawaii Department of Health, and she is going to be discussing the ICAR program. Thanks for being here, Kelly.
Thank you. Aloha, everybody. So go ahead, next slide. So just want to review what an ICAR is. And for maybe most of you on this call, you've already received an ICAR. Maybe it's been done by your state health department or some other entity, but an ICAR is an infection control assessment and a response. And it's a CDC tool that we have been using. And this bulleted list is just a snapshot of what the ICAR is and what the assessments pertain. And this is straight from our flyer. We did end up creating a flyer, so folks knew exactly what we were trying to do. And so essentially we are wanting to assess your infection prevention program. And we do look for some of those best practices. We often get the question, what are other facilities doing? So it's nice when we can share some of those. This is offered at no cost right now. These consultative services are grant funded. So I really encourage those other states and even our state to continue to have us just come in and see if there's anything that we can offer. It is a general overview of the program, and we have lots of tools in our toolbox that we can share with you. We know you don't necessarily keep up to date with everything out there, and so we try to do that for you guys and be able to provide the most up-to-date resources. It is about 2 hours long. It can go over, but that's kind of an agreed upon time that you set aside, and we want to be work around your schedules. So we ask you to let us know when you have availability. The team that we have at the ICAR generally is the director of nursing, for sure the infection preventionist. Environmental services is nice to have there, as we want to make sure that they are included in that infection prevention team, but the questions they can answer for us around environmental cleaning. Next slide. And just a little bit more about, what's in it for the facilities. They'll gain this non-regulatory consultative assessment. And that's been pretty important to make sure that we explain that we're non-regulatory. When we call or we email and we say we're from the Department of Health, most often it's, we don't want you to come in. So we just want to make sure that's been pretty key to establishing this relationship with the facilities is just non-regulatory. And, it's this assessment, and we take away whatever your needs are, and we'll go out and try to find or answer those questions that you guys have. So it is tailored, facility specific to you guys. What's great is that you have this ongoing partnership with us at the Department of Health. And I think that's been the most valuable benefit for us, is this relationship building and just that trust that's been built with the leadership in the facility and Department of Health. Go ahead, next slide. So CDC has these ICARS that are setting specific. So you can see they do have ICARS for hospitals, long-term care, outpatient, and dialysis. They're very long. I don't know, I think I just looked at the 2023 one and it was like 88 pages. So what we did was we took that CDC template and we got it down to about 10 pages. And then maybe put in some Hawaii specific questions we wanted to ask for our facilities. The ICAR is based on these domains. And so last year, as well as so 2021 and 2022, we looked at these domains when we were doing the ICAR. And 2023, the ICAR did get updated from CDC. And so I think our plan will be more like a drill down on specific domain areas. We won't necessarily need to assess all areas because we've already done it for most of our facilities. And if you take a look at this group of domains too, it was very interesting that the top 10 deficiency, according to your peers, it was a Mountain Pacific flyer that just recently came out. And each of those deficiencies are listed in this domain. So the ICAR is really beneficial in assessing the program and getting folks ready for a survey. Go ahead, next slide. And I just want to thank my team. So I think I did see some of us on here, Carol Lopez, Katie Spalding, and Katie's in Kauai, Carol's on Oahu, I'm on Big Island, and then we have a team, Sherry and Jalen, taking care of Maui. And so you can see that the long-term care facility table on the left-hand side, we have 45 long-term care facilities in Hawaii. And I think most know we're made up of 4 counties, so the main 4 islands. And I started September of 2020, and by the time I started, all of our long-term care ICARs had been completed. And my colleague, Carol Lopez, I didn't know this about her. I was going to tell her that they got done probably by the end of the summer because she was a bulldog. She would call these facilities, we're in this middle of the pandemic, and she would want to make sure that they got an ICAR and they had an opportunity. So come to find out, on Friday, I did hear that Carol's nickname was Bulldog Carol. So thank you, Carol, because you can see in 2020, we got to all of our long-term care facilities. And if you look at the other table, other areas that we did assess were assisted living facilities, our adult residential care homes, dialysis, ambulatory, and those inpatient hospice facilities. So we had a little momentum in trying to get in 2020 for obvious reasons. We continue to have long-term care facilities as our target areas for 2021 and 2022. And while we would continue to like to have 100%, we recognize folks are busy and may be overwhelmed with other things. I know that my facilities on Big Island, I tend to schedule towards the end of the year. So already I'm trying to schedule for January for one facility, but so anyway, we do still want to encourage folks to be doing these ICARs, especially while there's money for it. Go ahead, next slide. If you look at our 2020 and 2020 themes, 2021 themes, they are very similar in that because most of the issues that were at the beginning of the pandemic kind of bled over into 2021. So it really stemmed around that using personal protective equipment, our recommendations on auditing, risk assessments. I look back on this and it was almost like I was becoming a little anxious remembering all of these things that we did. And so I'm certain that you guys can relate to some of these things. And so if you were to go to the next slide, part of our job at Department of Health is how can we help you guys? And so you can see that these were the interventions based on what we were finding in our ICARs. This is what we did for you guys. So really trying to improve that ICAR process. So standardizing by developing a protocol. So, folks after us will know how we supported the facilities. The standardized ICAR report is great. It's, what you have in place and then what are those areas for improvement. And then some other protocols we also put together, and it's really staff education. So using the ICAR and trying to educate your staff on those areas for improvement. Go ahead, next slide. And then 2022. So again, we're still looking at the infection control program, and some of the themes continue. So those overarching programs underneath the infection control program. So antimicrobial stewardship, and I call it you have an audit program, which includes hand hygiene, PPE, cleaning, disinfecting. So always trying to make sure that you're continuing improving, not that you get to your goal and then necessarily stop. And then what we did in 2022, it really seemed like we needed to get some networking going. We have a lot of new IPs and turnover. So we focused on networking and then training. So we have a HIPPing group, we call it, a Hawaii Infection Prevention Network. We've met 4 times now, and it's been great. Just lots of information sharing. We have a listserv, lots of questions going back and forth. So that's great. Because what we were hearing was there wasn't necessarily a group for those long-term cares to share questions and ideas. Project First Line, we're going to be launching the training program. We just completed our learning needs assessment, and encouraging folks to be signing on and listening to It's Worth a Shot. And then we have a pharmacist as part of our HAI team, and so trying to help long-term care facilities enhance their antimicrobial stewardship program. And then just trying to, help folks get compliant with those CMS OSHA requirements, and doing some fit testing. Go ahead, next slide. So part of any program is you want to evaluate it. And so Carol developed a survey, like a monkey survey that she sends out. And so we did get 71% response. Go ahead and so trying to figure out what area maybe we have impacted the most. So this question, I've been able to make at least one significant improvement. Most agree. So that's good for us to know that it was at least helpful. Go ahead, next slide. And then has your participation in the ICAR program led you connect with any of these groups? So again, making sure folks know who to network with and that they're reaching out. And next slide. And then just making a check back on the domains. So what area got impacted the most? And you can see that, not surprising, PPE is on that list. Healthcare personnel and resident safety were the top. Procedures and policies. One thing I did want to say about policies is, as we're assessing, if I were to take surveillance as an example, making sure that your surveillance policy matches what you're doing. So the example is your surveillance policy might say you're looking at your infections by a rate of infection. So it might be, your infection over the number of patient days. But when we go in and we're asking for the rate of infection, whether it's on a graph or a piece of paper, no one's been able to provide that. So we know that some of you have, I think, point-click care, some tools that can graphically display your infection data. And it's just so you can monitor patterns and trends. Go ahead, next slide. And then, of course, did the ICAR help with identifying infection prevention priorities? I think that that's really part of what we want to do is help you identify those CMS and OSHA, those regulatories, make sure that you have those in place first, and then, the guidance afterwards. And it's essentially a gap analysis for you. Go ahead, next slide. And these are some of the comments that we got on our survey back from the facility. And so I think, we are able to provide information complementing what you're already doing, helping you pass survey, training any new staff that you might have, and just pulling out some tools that we have in our toolbox. And so as we evaluate our ICAR program, of course, we're going to always feel like it was effective. And in assessing and supporting your infection prevention program and long-term care specifically. We provided a guide for QI opportunities, new training for IPs, as well as preparing folks for regulatory surveys. And thank you. That's it.
Thank you, Kelly. I appreciate it. If anyone has any questions for Kelly, feel free to drop those in chat. All right, our next guest speaker today is Ashley Tanner. She is the administrator at Sydney Health Center Extended Care in Eastern Montana. Thank you for being here today, Sydney. Or Ashley, sorry. I think you're on mute. There we go.
Yes, thank you so much for having me today in Mountain Pacific for having It's Worth a Shot. We really appreciate this for all the long-term care facilities. So today, I'm going to talk about a little bit following up with Kelly, and I forgot to put this in my PowerPoint, but the COVID-19 mitigation strategies that are best practices that we've been trying to implement here at Sydney Health Center Extended Care, and using tools like the ICAR to really start to put together the framework for how we react, intervene, and mitigate COVID-19 in our facility. So just some topics that have come up over the course of COVID-19 outbreaks here at the extended care. We've ended up having a dedicated COVID-19 unit with dedicated staff, looking at the policies and procedures for making sure staff are using PPE appropriately, disinfecting appropriately, making sure we're following our screening guidelines and our CMS guidelines, which we all know have now been a little bit more relaxed, but I think having those as guides to make sure that we're actually defeating COVID-19 in our facilities and lessening the burden of COVID-19 signs and symptoms on our staff and residents have really helped us mitigate COVID-19 and keep it contained. We also had a dedicated bathroom to positives and thoroughly cleaned after each bath. This also was identified in our ICAR when we had it with the state. So please take advantage of those great tools that we are using, even the CMS COVID-19 outbreak surveys. They're very helpful in putting together a plan so that when you do have to make these decisions based on COVID-19 transmission and positivity rates, we're doing so effectively and safely. We use a number of air purifiers all across the facility, strategically using our maps to make sure that we were trying to figure out the best placement to make sure that when we were entering and exiting doors, we had an air purifier strategically placed. Of course, N95s and PPE cards. And on my next slide, you'll see that what our wonderful infection control department, shout outs to Suzanne and Danielle, who put these together for us. But every time we get an N95, as you can see on my badge there on the top of the screen, we have our name, what is the manufacturer, what model, and what size, so that when we hit an outbreak, immediately we respond by using our one-time use PPE. And on the back of the card, just proper donning and doffing and making sure that we notify people when our fit testing is and when is an appropriate time to refit test. We also just did some strict contact tracing, and it's a lot of manpower and a lot of work. So even during the days where we weren't sure, we tested, we strict contact trace, and then eventually if we had to move to broad-based testing, we definitely moved to broad-based as noted. We worked with public health. We worked with our local public health, Erica Baldry in the state. They also do an amazing job at helping you get out of those stuck moments. So don't be afraid to reach out. We've made a lot of mistakes over outbreak after outbreak, but we learn from them, we take the opportunities, and we're using all of these opportunities to set up, as you see, and below the picture to the right is our COVID-19 testing station. And so we have the completed COVID-19s, we have all the different type of masks. So when they first come in, they never hit the resident care areas and they have to sanitize. We have our cavi wipes, gloves, everything set up, ready to go, so that if you do encounter a positive, you never come into the building, you turn right back around and you exit. We hopefully have stopped that when we first started this. We started testing under the awning and outside through our drive-through service. So that really has made a big difference in making sure we're mitigating COVID-19 for our staff and residents. So with that being said, I want to move to the next slide, which is our survey preparation. So always keep your survey books ready. I know every good administrator on this call has one. It is somewhere. It may be a little dusty, but dust it off. Make sure your policies are up to date, your staffing. I will tell you the very first thing that shocked me during our annual survey is that COVID-19 vaccination staff list must be done before survey enters, or you will get the citation if not in 100% compliance. Remember that compliance means either you're exempt or you have the full series of vaccination, and that form must be completed. Do not do like I did and drop your job, because I'm telling you, you want to complete that form before a survey comes. New people, you can add those in quickly on the end, but just making sure you have that full list up to date. Ensuring your COVID-19 policies match what you're saying you're doing, what you are doing, and what CMS regulations or state and local regulations say. I think that was one of the big opportunities that we did not get cited for infection control or COVID-19 during our outbreak or survey. So I'm very thankful that wonderful infection control team stepped up. We did some triple checks of the policy. We made sure that there were guides and flow charts to show like when we're in different transmission statuses and how well to explain that in a quick breakdown and overview of when do we need to test, how do we test, what are our infection control processes, and just really making sure those policies are up to date. Also adding that survey prep to your team meetings and huddles and your monthly meetings. One great thing in our ICARS that we identified is the spacing of hand sanitizers. I always thought we had too many. Nope, you could never have enough. When they come out, our team has done a diligent job with that hand washing tool, speedy hand washing. I think that's the name of it. Correct me if I'm wrong, Jesse. The speedy audit tool, also the hand-based sanitizer in and out of rooms. So in all resident rooms, there's sanitizer, and upon exit within distancing between resident rooms, we have sanitizers, and plus good old hand washing. Never forget that. Just add those things to your survey prep. Always try to think about mitigating COVID, because they can ask you at any time for any of that information, and learn from the opportunities. One of the questions that I think we talked about during our ICAR and our CMS is how do we get people to clock in that were on that dedicated unit? Well, that's an opportunity to take a look at your setup and see, maybe I need a timesheet book, or maybe I need to put a dedicated person that's entering time for people that are working in a COVID-19 unit so they can exit out of the building safely without walking all the way back through the building. Just being objective and looking at all your processes, you know, as they change and as we go through this continuation of COVID-19. We're still a pandemic, watching for flu, screening employees even before they get sick. If they feel like they have a sniffle, take that and, hey, let's get tested, let's follow up, let's take a day off, and not being afraid to feel some of that pressure. Just because, you know, we are in a pandemic, we have been struggling, but we can do this. We have made it through 3 years of the pandemic. And so rallying together with other facilities as well to share these best practices, and just seeking information and being creative in how you set up your units that are specific to your facility is the best advice I can offer up for you today.
Thank you, Ashley. It's so nice to hear from a center to hear what worked well for you guys, and know that everyone has been in this together, and moving forward, everyone will be in this together. So we certainly appreciate you joining us today. And there's a couple questions in chat. I knew those badge cards were going to be a hit. We have folks wondering where we can find those fit testing PPE cards, the
I
template.
will have to, again, shout out to Suzanne and Danielle who came up with this spiffy ID card. I can forward that to you, Jesse, to send out
Okay.
or send to everyone that's on the call today. This thing has been so handy. I mean, I just bust into the room and get my N95 when we're ready to go. So I don't even have to think about it.
That's wonderful. And I like how you put the expiration on there too, so folks know when it's time for them to be retested.
Yes.
And it's right with your name badge. I knew
Right,
that
that's
was
my
going to
name
be
tag.
hit.
There you go.
um, let's see here. It looks like any other questions for Ashley?
Jesse, we had one more. It says, with when an employee gets the primary but refuses the booster, do they need to sign an exempt, or what are others doing? So it looks like kind of a question for the group as a whole.
For us, on that COVID-19, we marked them as partially vaccinated, and then just asked them if they were done with the exemption, if they wanted to get the exemption paperwork to make sure we were covered, since they didn't want to get the secondary dose.
Thanks, Ashley. And I'd have to go back. I think our language still focuses on that primary series, and that's where the direction comes for the exemption. I can go back and find that language too, Deb, and send that to the group. But good question. I'd like to know what others are doing too, if anyone else wants to offer. Lots of positive responses. Love the badge cards. Thank you to both of our guest speakers. Yeah, and I don't see much feedback, Deb, for your question, but I'll look and see what I can offer too. Oh, and it looks like, so Deb, it looks like Sabrina, we only offer exemption for those that have refused the primary. Yeah, so that would align with the current technical guidance. Well, as always, we thank you. We thank our guest speakers. And you guys need anything at all, please reach out. These are recorded. We'll send them out next week and they'll be on our website. Join us next week, Wednesday, January 25th. Same place, same time. Take care and be well, everyone.